So Marisa, I wonder if you could start by telling me about your clinical life. What is it that you do now?
Well, I'm a geriatrician at St. Michael's Hospital, and right now I do mostly outpatient clinics. I do 4 days a week. I work only 4 days a week.
So like me, you're a McMaster graduate.
Yes.
And when you were at the end of your second year at McMaster, there was an accident that changed your life. Could you tell us about that?
Well, it was the 26th of February. I believe it was a Wednesday in 1974. And I was coming home from the library. It was almost midnight in Hamilton. A clear night. There wasn't snow on the ground. It was cold, of course, middle of February. But anyway, I was stopped making a left-hand turn, waiting for traffic to pass me in the oncoming lanes. And I was rear-ended by heavy, massive car, and I was in a very small car. And I had a spinal cord injury. I don't know how I survived. They tell me, because I can't remember, that they had to take me out of the car with, what do they call it, the jaws of life. And they brought me immediately to the hospital. They did emergency surgery. No MRIs in those days, of course. I had a myelogram, old-fashioned kind of medicine. And I mean, I was okay, but my spinal cord was not. So I was turned paraplegic overnight, in split second.
And you were 27 years old.
27 years old, yes.
So you went for rehab in the United States. You spent a period of time in New York.
New York for about, from June to October. And there they taught me the latest in methods in terms of how to take care of yourself, how to use a wheelchair. I mean, they had very advanced techniques at the time, things like intermittent catheterization, which wasn't practiced in Canada at the time, and you know, how to do bowel routines, things I'd never thought I'd ever have to do for myself. But I learned, and lots of anxieties, of course, coming back. But, you know, managed. It came back. I had to find a place to live. People in Hamilton helped me. They put me in one of the graduate students' little apartments on a ground floor, which had accessible shower and accessible everything. And somehow I managed, but survival was the key of the day. Actually, the story was they didn't have a place for me at all. So this is a funny vignette. I inaugurated one of the rooms in the ICU at MAC, the MAC Mumsy,
Yes.
which had not opened yet. So it was an ICU room that had accessible bed and bathroom and things like this. And one of the nurses, my very good friend, Dorothy, she used to come in and check in on me in the ICU. And I had the key that opened the lock to the ICU that nobody else was in.
Wow. I mean, who would even believe it? It's
Nobody
just
would
like
believe
out of a
nobody would believe
television
this,
drama, right?
Yeah. You know, I mean, and there weren't that many accessible places to live at the time. And then they found me a room in the residence, and I was okay after that. I had to get a car, learn to use, and of course, no hand controls on cars. They didn't manufacture them at the time, right? I learned how to drive in Manhattan with hand controls, but they had to be machined, like a mechanic would machine them for you, because now you can buy them from Amazon.
Wow.
In kits.
Yeah. Okay.
And anybody can do it. But then they didn't have that. So a local mechanic in Hamilton jigged my car up with hand controls.
Can you talk a little bit about how people supported, or maybe focusing on how they supported you at the time?
Well, the first thing, they didn't kick me out of school. They gave me a leave of absence for a year, and I was able to join the class that came after me, the class of 76. And of course, there were some hospitals that I could not access because there wasn't accessibility, you see. There were some rotations that they had to have some accommodation, like the surgical rotations in clerkship. My instructors had to think, well, how do we teach someone to do the palpation of the liver when they're in a wheelchair? They didn't have POCUS in those days, like the ultrasound at the bedside thing, So you had to learn all these clinical skills, and how does one do that? So there were some that were doubters and others that were facilitators, and thank God I got a lot of facilitators. I got certainly the support of the dean, and then when it was time to graduate, I was able to, they offered me some letters of introduction to some of the PICs in Toronto to get into postgraduate training. So that's what, and I did have some very good people who probably believed in me more than I did, but anyway.
When you think of those people, I mean, the people that maybe you would consider your champions, what distinguished them in their attitude or how they saw your situation?
I think that they were kind individuals. They had vision. They were just humanitarian. They were just human beings, Although they were scientists, researchers, well published and acknowledged, but they just had a very human quality to them. It's hard to explain. That's not everyone. There were detractors too who said, well, she'll never make it, or she just should do psychiatry. Mind you, I probably would have been a good psychiatrist.
I think you would have.
Never mind. But nevertheless, anyway. Yeah. So they were, I think, willing to take a chance.
Well, it's a kind of investment, isn't it? It sort of makes me think of any mentorship relationship, and clearly it paid off.
Well, I think so, They made a big difference in my life, for sure.
I find myself thinking about the cognitive load and the logistics that people with accessibility needs face every single day in the world, but then trying to translate that into the hospital environment and accessibility. What are some of the things that you think the average person who's never had to either themselves face a mobility challenge or have a loved one who did or be in a wheelchair, what are some of the things in terms of day-to-day life at work that would shock or surprise people?
It's like the song, Where Do I Begin? Yeah. I mean, even getting to work, figuring out what kind of transit you're going to have, or but simple things like ramps, a little ledge like that, doors that are too heavy and you can't push, how you carry a cup of coffee and still open a door at the same time. The energy that people have to exert when they don't have the energy. Yeah. I mean, when you don't have your legs, which are the most strong muscles that you have in the body. Just the energy load and the problem solving that you have to do every single minute. Yeah. If something drops on the floor, how are you going to pick it up? You know, what strategy are you going to use to pick that up? So you take one of your examining hammers, you put some Scotch tape at one side and roll it up, and you do that. And you pick up whatever is on the ground, because there isn't anybody around. Yeah. You have to do that. Yeah. So you have to think of all kinds of ways of working outside of the box all the time. So doors, signs, elevators that broke down. Just the other day, I was caught in the elevator at St. Michael's all by myself. It broke down. I waited an hour all by myself in this elevator. And no way you can get out. Yeah. So that was elevators that break down. I can't imagine. It was worse at one time. It's better now. Mm-hmm. The other challenge for me, from a professional point of view, is the networking. Yes. How do you work a room? Yeah. Yeah. You work a room, you walk around, you speak to people, you see somebody over there, you want to go over there, and people in wheelchairs or walkers or even a cane sometimes, they can't do that. Yeah. Yeah. So you have to somehow find some way of attracting attention. Yeah.
Which is added cognitive and emotional load. It's more work for every single step.
And then you have to go home and survive.
And you talked about some of the things that the champions, the real supporters, did sort of emotionally and in terms of helping you see and advocating for the career that could lie ahead of you and did lie ahead of you. But I'm thinking, just as you talk about that example of, dropping something and needing to MacGyver a solution in that moment, what are some of the things, the colleagues in your immediate environment, whether they're physicians or allied health, what are the things that people do in your immediate work environment on a day-to-day basis that help the most, that make the most difference?
Well, they help me solve with technology, of course, because with all these electronic systems, which we were not trained in my youth, so they help with that. But what else do they help with? They bring me a cup of coffee in the morning, so I don't have to go to the cafeteria and get one for myself. Or they ask, and anything we can do. Or they say, if you need somebody to go with you, they will come with you. Because it's not that I can't drive my car. I got here today. Mm-hmm. But you never know when you're going to any place whether there's going to be a problem and how are you going to solve it. Cell phones have always helped a lot because you can always ask for help, for sure. But my colleagues, they accept me. I mean, they're my colleagues. I don't think they think of me as someone who's disabled. Yeah. At least, I don't think so. But anyway.
You make me think of the difference that, we sometimes talk about between inclusion and belonging. So when we include people, well, that's really important. But if they don't feel they belong, what does inclusion matter? We haven't achieved anything with it, really. And that's sort of what I hear, that you've that sense of belonging, that through anticipation, thoughtfulness, concern.
So, I mean, if there's a meeting we have to go to at the university, you know, someone will say, well, you know, can I go with you? Or we'll take a ride together or whatever. That's always very helpful. What else can I say? They'll come in and talk to me about what the new baby did or something else. They talk to me, or they're, maybe this not so much for the camera, but they'll tell me about their girlfriend problems, or, you know, like I'm like a matriarch or something of the group. Not so much at the beginning, but, you know, when I was much younger, but now, yes. Or they will discuss some issue they're having.
We were talking a little bit before, too, about how patients relate to us as physicians when they know that we have an illness, or maybe they see that we have a disability, or they hear that we have an invisible disability. And I wonder if you could share just some of your experiences or just thoughts about how that is helpful and meaningful to patients.
Well, you know, you always, so this is, I guess, a lifetime reflection. You always think, well, I'm not, you know, I'm not as good a doctor as the others. I'm, you know, I can't do this and I can't do that. And, but over the years, what I have seen and learned is that I probably observe better. I certainly listen a lot. And people tell me a lot. Now, sometimes they come into the office and they'll say something. Oh, finally, a doctor that understands. Now, that's a rude remark, but in some ways, you know, it's rude, yes, but in some ways, they somehow get the feeling that somehow maybe I will understand their point of view, their pain, their sense of disablement, their whatever it is. And I hope that I come through. Sometimes I don't or can't.
I wonder, thinking on some of the experiences, and particularly in recent years that you've had, being a patient, having had some serious illnesses related to being paraplegic, I wonder what thoughts you have, knowing that folks who are listening to our conversations, these are many of our members, practicing physicians, what would you like them to know about caring for people with disabilities?
As you know, or we talked maybe about a bit about it before, I was in the hospital itself for a year, an entire year in acute care and in rehabilitation. And so I experienced firsthand what patients in our system, our medical system, actually do experience, okay? The real lack of autonomy, the real dearies and, you know, diminutives that people mean with kindness. I mean, but when it's directed at you, it sort of really puts you in a vulnerable, diminished position. I mean, for sure. You know, don't get me wrong, there are a lot of kindnesses as we're going around. You know, you do get nurses that will bring you that extra cup of tea and maybe do a little back rub now and again, although that's out the window for most part. But your question about what people, I mean, you know, people will say, I hope, say, tell me if this hurts. But I mean, you could cut my legs off and I wouldn't know because there's no sensation. So there is no sense of pain in that area, you know, or so there's a lack of real comprehension of, you know, it was hard to even come at a diagnosis for me because all I could say is that I feel sick, but I can't tell you that it hurts over there. And the problem was in my butt, which I can't feel. So even in medicine, you know, there is, for medical people, it's hard to comprehend how to approach a problem when a patient cannot feel, sort of describe what is happening to them. It's like, you know, in some ways, you have to think outside of that box and say, okay, something's going on here, things aren't adding up. What do I have to do to really try to find out what's going on? It's like somebody, you know, trying to figure out what a baby is feeling like when they can't tell you.
It makes me think of, you know, sort of the gap between our knowledge experience, learning about something, having words to describe something vicariously, versus the lived experience. And so often, I think in medicine, especially when we're younger in our career, before we've hopefully developed some wisdom to go with that knowledge, there's often the sense that, well, that knowledge is superior to the experience because it's, you know, it's thorough and it's detailed, but it really is not terribly aligned very often with the lived experience of a symptom or an illness. Yeah.
So I always, you know, it was a big learning experience for me too, because, you know, when things don't add up, you have to think outside of that box.
Marisa, I know we'll have some physicians and colleagues and other listeners hearing our conversation today who may be going through really hard times themselves. And I wondered if you think of some of the most helpful framing or beliefs or words that come to mind, things that for you at some of your hardest stretches have been helpful, thinking about how you would carry on and keep moving through medicine. Is there anything that bubbles to the surface for you?
We never know what impact we really have, okay? But there was one medical student in my very early on in my career who, I guess I was at Sunnybrook at the time, and I was their mentor. And many years later, this individual came up to me as a family doctor and said, you know, I had multiple sclerosis, and I was diagnosed when I was your student. Yeah. I said, really? She said, I just want you to know that if it hadn't been for you, I would have quit medicine. So that was an inspiring moment. Things like that keep you going, to know that that day you actually made a difference.
You know, as I hear you tell that story, Marisa, what I find myself thinking about is we have no idea the impact that this conversation as we have it today might have on someone who's listening in just that same way.
I'm what can I say? I don't know. It's not, yes, we hope that it does. And I don't know why it keeps me going. I've been in practice now. I graduated almost 50 years ago. you know. And I still go to work. I still get joy out of getting up every morning and meeting the day head on. I don't have as much energy as I used to, but I can't explain what the driving force inside is. I just love relating to people, and yeah, and it's what probably keeps me going. And I really had very few encounters with the acute medical system until 2022. I was pretty healthy, actually.
Well, am I ever glad that you rebounded and that I am sitting across from you today soaking in your life force and getting to hear your wisdom.
In general, I think of my life as being boring. So it's not, it's not full of excitement or bubbliness or anything like that. And yeah.
Thank you so much for coming to talk to me today.